2023. I hope it was a good start for all of you. We're on day one of the shortest month of the year. I'm looking forward to it. Of course, the daylight hours are getting a little longer. I see, Paul was telling me he's wearing red today because of Go Women Health Awareness Day, and Groundhog Day is tomorrow. We'll see Punxsutawney Phil's prediction. Of course, Valentine's Day is less than 2 weeks away. So, gentlemen on the call, here's your reminder. I know it always sneaks up on me. Do want to mention that Carolyn Murray and Meredith Belinsky apologize for not being able to make it this morning. And Paul's planned a great meeting for us. But we do need to start with the approval of minutes from January 4th meeting that Paul sent out last Friday. To what I'll go ahead and make a motion to approve those minutes. If I could get a second, please.
I second.
Thank you very much. We have a motion and a second. All in favor of approving those minutes from January 4th, please say aye.
Aye.
Any opposed? Okay, so the meeting minutes have been approved, and you probably saw in the minutes too, if you want to take a look at the meeting schedule for the year, it is in the minutes, but it's going to be the first Wednesday of each month except for the month of July. We'll take a break that month. So to start off our meeting, we have our community updates. So I guess I may just start with Jennifer Roberts if you have any community updates for us.
Good morning, everyone. Yeah, I don't have too many. I guess we're still not open at our crisis stabilization center. We are waiting. I think DHEC is coming to do the walkthrough to relicense us on Tuesday. But we will do a press conference and let everyone know. For those of you who don't know, it's our 10-bed voluntary adult unit that's located at the Social Services Hub. We're very excited to get it reopened. We will have all 10 beds open and be able to accept police drop-offs again, because we've been able to relax some of the COVID restrictions we've had really since March of 2020. So that's happening, and we just signed a lease for our building across the street from us. It's kind of diagonal. It's across the street from Channel 5 here on Charlie Hall. We're going to take the second floor of that building, and that's where the new 988 call center will go. That's going to be the backup 988 center to Mental Health America Greenville. We are in the process of hiring people now to help assist that call center to be able to answer all the calls in our own state. I think I mentioned last time, it's important for all the states to get all the calls answered in their own state, because all the states know their own resources better than anyone else. But just so you know, if anyone does call 988, the emergency line, it will be answered by someone. It might roll over to a different state at this point, but the goal is to get them all answered here in South Carolina. And we still have our mobile crisis call center as well for emergencies. And I'm going to add some links in the chat for you guys. So Mental Health Heroes is our associated nonprofit. It helps us put on our conference that we have in July. And so I'll add a conference link for that. This is a licensure year for counselors. So we're expecting to see a lot of people. We'll have it virtual and in person. We're going to have a golf tournament on March 22nd at Dunes West Golf Club. So I'm going to put a link to that. That's also a fundraiser. All the money that we raise through Mental Health Heroes goes to help our patients pay for medication, housing, emergency, light bills, just kind of anything that our patients need. And there's also going to be an oyster roast I'm going to try to find a link to. And this year we're going to have a pickleball tournament, which I've not played pickleball. Maybe some people here have. I hear it's fun, a lot faster than tennis, I guess, right? So I'll try to put all those links. If I can't get my hands on them by the meeting, I'll send them to Paul and he can share them with y'all later. But yeah, so we have been able to raise some salaries here at Mental Health for our mental health counselors, our master's level people. So we do expect to hopefully build back our workforce this year. So I'm looking forward to a great 2023 for mental health. So that's my report.
Great, thank you very much. Any questions for Jennifer Roberts? All right, very good. Maggie, anything to report from Charleston County Schools?
Sure. Thank you, Councilman Shealy. So as we transition into the month of February, we do have some flu clinics still going on today, Thursday, Friday, and Saturday. Those are on our website, and they're at a variety of locations around the county area, one in each constituent area, with general hours between 12 to 6 or 10 to 7. With the weekend clinics from 12 to 6. So we definitely encourage our students and their families to utilize those throughout the beginning of this month. A couple of other things that have just started is the beginning of our school choice application period. Our school choice, these are for our schools that have magnet seats, either their constituent area magnets, so magnets for a geographic region, or they are admissions-based magnets like School of the Arts or Academic Magnet, Youth, things of that sort. The application period occurs from January 24th to February 24th. And so throughout that month, families can go onto our website, they can create a portal account, and they can make that application. And then there will be a lottery process, which occurs between February and April, and then around April 3rd, application decisions will be released to families. There is a virtual choice fair that families can join. Well, that was this past weekend, but we have a couple of other options for families to go on and see videos of the choice schools. And then we have application assistance events throughout the month of February, and I'll drop a link in the chat for this. Simultaneous to that is the launch of our early learning program application. So this is for our pre-K or what we term as CD, child development, for our 4-year-olds. That application launched January 24th. It doesn't have a deadline the way school choice does. It's a rolling application period. So families can go on, they can sign up their children, same to general K-12 rules. The student has to turn 4 by September 1 in order to be eligible. And so families can go on and apply and sign up for a time to be screened because it is needs-based, and it is meant for a child-zoned neighborhood school. So when you apply for that program, you would be applying for wherever your child would attend kindergarten through 12th grade based on your address. And again, I'll put some links to that in the chat, and there is application assistance available for that as well. So those are kind of two pretty important items that just launched. Also, our Kaleidoscope program, our expanded learning program, after school program, has started allowing 4-year-olds back based on licensing that they received at about 22 sites. So they are working directly with families there that were on wait lists. But just wanted to share that information as families plan for next year, whether they have siblings that are in that 4-year-old CD pre-K range, or they have students that they want to enter the system, that after school program will be available at least 22 of our sites, and hopefully more by the time the 2023-24 school year launches. That's all I have today.
Thank you, Maggie. Any questions for Charleston County Schools? Okay. Nick Osborne, did you have anything?
Thanks, Councilman Shealy. Not a lot other than just to say that we continue to see significant demand for support across our service area. Just as a barometer that we use to sort of track some of that high demand, we do offer emergency assistance for clients that can come through our front door here at our facility. And certainly since November, we've been seeing anywhere upwards of 800 people coming in, 800 of our neighbors coming through the front door looking for emergency assistance. I mean, that is significant in comparison to months earlier, and continues to remain high as well. And I think is indicative of some of the challenges that many people are facing in terms of the cost of food, inflation, and other implications on hardships that people are facing. So we continue to track that and continue to see demand for food assistance continuing. Something that we are doing at the moment to make it easier for our partner agencies to be able to access food from our facilities. We're looking at putting in place an online system for ordering food from our facilities called Agency Express. And this is something that we are very much looking forward to in terms of making it much easier for the accessing. It's more like an Amazon type of experience. So one of our any partner agency can go online, can order food, can come to our facility, can pick food up in line with a fixed schedule based on what they've ordered online, as opposed to the systems that we've been using before, which has generally been email based. So very much looking forward to our ability to create efficiencies and the experience that our partner agencies are going to have in terms of accessing food from our facilities. Just to say, we have our annual Chef's Feast as well, which is taking place at the end of February, on February the 26th at Trident Technical College. This brings together some 30 of our chefs from around Charleston, together with some 400 participants. It's an opportunity to raise awareness amongst our community to issues of child hunger. And so it's something, as I said, that we do every year and something we're very much looking forward to. Happy to send the link to you, Paul, when we're finished as well, so that you can get some more information on Chef's Feast. But those are some quick updates.
Thank you very much. Any questions for Nick Osborne? Okay, well, thank you for that. Kimbo Yee, anything you want to report from the Citadel?
Everything's pretty smooth sailing here at the Citadel. In terms of the community, I am still working logistically on running a spring session of the same sort of running and healthy lifestyles program that we did with our nonprofit partner in the fall. So stay tuned for that on updates, hopefully in the coming months.
All right, great. Thank you very much. Tracy, did you have anything you wanted to share under our community updates?
Nope, nothing from me this morning. Thank you.
Great, thank you. I know that Paul did want to share something that that DHEC's doing. He's I'm going to call on Paul to do that if he would, please.
Do y'all see that on the screen? Katie, do you want to just briefly talk to us about that?
Sure. So we had a community meeting at our new Charleston County Health Department, which is the social services hub. We're co-located with the Charleston Center, DAODAS, DSS, and soon the Crisis Stabilization Center, as Jennifer mentioned. And at that health department and at all of our health departments across the state, we are offering continuing to offer free COVID test. So you basically just walk into our clinic site that's on the second floor and ask for COVID test, and they are given to you. And I think it's a great idea to just have them around. Some of those that we were giving out originally may be expired now. So if you got some previously, please check those, make sure they're still within the expiration date. The second photo, the naloxone, the other name for that is Narcan. And this is, Narcan is one of the brand names. This is the generic, is part of our safety kits. So for about a month now, DHEC has been providing brown paper bag with a box of 2 naloxone nasal sprays. Those are used to treat opioid overdoses. There's also several fentanyl test strips for users to be able to test their product to see if it contains fentanyl, which makes it increases the risk of overdose. And there's also information. Suicide hotline and information on getting treatment for those who are ready to pursue that. And there are 2 questions that are asked, but they do not need to be answered. And so these safety kits will be given. And I don't know if you remember, Paul, I think we'll give up to 2 per person, but they are available. I got one at the same time that Paul did, and now I have my naloxone in my purse in case I ever have occasion to use it. It truly is one of those things that more and more frequently is saving lives in our community. So especially for those with family, friends, and colleagues who may be taking opioids, either prescription or illicit substances, but also those just of us in the community. We never know when we might be able to save a life with this. So thanks, Paul and Councilman Shealy.
Thank you very much. Any questions on that? All right. And I don't see her picture, but I see Susan Johnson's on. Did you have anything you wanted to share?
Yeah, sorry, I'm not on camera, but nothing specifically for MUSC, but I did want to give a reminder, since Paul's wearing his red, that it is Go Red Month, and it kind of culminates with the Low Country Heart Walk. So that'll be the last Saturday of this month, the 25th at Brittlebank Park. And there's plenty of opportunities to still sign up as a team. I think we've got over maybe close to 50 companies now that have teams. And then we also have a Move More challenge. And so once a person sets up their account on the local Heart Walk, the Low Country Heart Walk, there's an app that they can download onto their phone and they can track steps. So just wanted to share that and encourage everyone to sign up.
Great, thank you very much. And the only other person on here that I haven't heard from, not to put you on the spot, Councilman Mike Seekings is on. I don't know if you had anything to share, Mike. Okay, that's all right. Paul, did you have something else?
I just wanted to hit three quick things, and I'll take Mike's thunder for a second. But we got the heart health program that's going on, Go Red. We got the Cupid Run happening, I think, this weekend as well. Seaweed's coming into town. The heart health program of MUSC's children's program is having a run next weekend at Hampton Park. And then we've got Head for the Cure race out at James Island County Park. The same as the Heart Run on the 25th. And I just encourage it. It's nice to see a lot of physical activity being promoted in our community. And there was a great article in today's paper featuring the College of Charleston, Morgan Huey, talking about their efforts that they're working with cities to connect green space and parks and link them into communities. So it's a 10-minute walk or short distance for people to get to their park system. So physical activity, I know Kimbo is working hard on his end, and we just got to always remember that's part of the equation is we've got to all get ourselves being active and moving around. And then I will say the Bridge Run is April the 1st. I think we're going to do some downtown running clinics here in the coming weeks and try to use Stony Field. The Kids Run, we had over 1,300 participants or 1,400 participants somewhere in there, and over 3,000 people at the event on January the 8th. And it was a great opening for the community to see how beautiful Stony Field is and accessible it is for the community. And then I know the City Council, we should be very thankful for our traffic and transportation, other departments of what they're going to do with King Street, working with the State Highway Department to try to make it more walkable and bike friendly and just opening up avenues around. And I know Mike's been working on those committees a lot. And it's nice to see us looking at the physical environment of our community and making it a more friendlier community. So thank you.
Paul, I'll just jump in on the Bridge Run. If any business who wants to participate in the as a company, we have a code for the South Carolina Healthy Business Challenge that is $15 off the registration fee. So happy to share that if you just want to email me. We can share that out. Or better yet, I would encourage you to go to our website, schealthybiz.com, and sign up for our newsletter, and then you'll get all that information.
Yeah, and with that quick note, I know we're running late, but we have 60 businesses already signed up to run the Bridge Run this year. That's 60 different businesses will be running as a team in the Bridge Run. So that's exciting too.
Nice.
So Kevin, it's Mike. Sorry, while
Hey,
you were asking me to speak, I was driving and Zooming, and that's probably not a very advisable thing, particularly for me. It's not particularly well coordinated, but thank you for giving me the opportunity. I think between Paul and Susan, they touched on a couple of points I wanted to touch on. You know, it's healthy season and culminating certainly with the bridge run, at least for the spring. I would really encourage anybody who's tied into any groups to get some groups together and do it either through Susan's access or right through the bridge run. We are encouraging large groups to participate, and we'll recognize them when we have our press conferences this year. So yeah, lots of things going on that are focused on health and wellness. So get involved, stay involved, and anything we can do at the city side to encourage all this or to give you some platform, we're happy to do it.
Great.
And I promise not to Zoom and drive anymore, because that is very unhealthy and and unsafe.
You probably shouldn't be telling an insurance agent that.
Yeah, that's exactly right.
All right, great. Thank you so much. Joey Current, I see you jumped on. There's something you want to share from Trident United Way?
Thanks so much. The only thing I have to share for folks is that we have a new set of community health needs assessment data that we just got published. I'm happy to share those materials with this group. And it really does kind of help highlight from a regional standpoint what the biggest health priorities are for folks in our region. And this data helps us prioritize kind of what initiatives in the human services sector that we fund and support and encourage across the Tri-County area. So I will send that along to Paul, make sure he can get that out to everybody on the call, and I encourage folks to read through it. It is the most up-to-date data that you're going to find on this kind of health information specific to our region.
Great. Thank you, Joey. All right. Very good. I do want to mention that there were some things put in the chat. So Maggie Dangerfield put some things in there, Nick Osborne and Jennifer Roberts. So just want you to know that there's some links and some other information in the chat as well. So so we are fortunate to have with us the Chief Executive Officer for Fetter Healthcare Network, Aretha Polite Powers, and she brings more than 20 years of experience to that nonprofit community-based health and human service organizations. She's responsible for a team of more than 145 professionals. She oversees the operation of more than 20 healthcare sites, including primary care, dental, behavioral health, school-based migrant and homeless programs dispersed among 4 counties. And do want to mention too that Fetter Healthcare was also awarded with the Community Heroes in South Carolina award by DHEC for their work with COVID. So, so I do want to call on now the Chief Executive Officer, Aretha Polite Powers, if you would, please. Thank you.
So good morning. I want to share my screen. Is it there?
It's there now.
You got it.
So good morning. Thank you for allowing me to just share a little bit about Fetter. I often feel like sometimes we forget that we have a federally qualified health center here in the Low Country that is very impactful in serving patients that are in need of medical care. Of course, our mission is to serve our patients with dignity, regardless of their ability to pay. And our program has a sliding fee scale based on the individual's household income and how many individuals actually live in the income. Our nominal fee for medical care is $30, and that's their labs, all of their specialty referrals, and oftentimes even their medication. And so I just want to make sure that when you all talk about Fetter, you communicate that, because either people come in and think we're a free clinic or they're not sure how they can pay for their care. And we want to get people into the health center. We serve the Berkeley, Charleston, Colleton, and Dorchester counties, and we are a nationally qualified NCQA patient-centered medical home. The purpose of the federally qualified health centers are to provide services in designated medically underserved areas or populations. And we're governed by a board, and 51% of our board members are users, or they represent users of the patient population. And then we provide all of the primary care services to include an array of enabling services, such as translation and transportation, food vouchers. We actually use our case managers to make referrals for rental and utility assistance. So patients, when they come in a health center, we try to make sure that we care for the whole patient and the entire household. We again provide those services based on adjusted fees. And one thing about FQHCs that I think people do not know is we have to report annually to the federal government, and they compare across the 1,500 health centers, the costs for administrative, clinical, quality, financial operations, and then we're awarded our funds based on our quality outcomes. I'm not going to name all the services, but again, we have an array of just general primary care screening services, subspecialty care. One of our biggest programs is our OB, our obstetrics program, where 98% of those individuals are either uninsured or on Medicaid. And when I say uninsured, it's because of their citizenship status. But we're able to provide those services on a slide scale. And be it as you may feel about individuals being served that are not citizens, if we do not do prenatal care for those parents, then we'll have children who may have some developmental issues, are not healthy births because we did not provide the parents with care. And so it's important for us to take people where they are, and we provide those services for them. Some of our newer services include the dietitian and weight management programs. And then we started our medication assistance therapy because of our high utilization of opioid use and abuse here in the area. And so we have a center that's dedicated to providing Suboxone treatment and also pain management for patients who may not have insurance or who are underinsured. We specifically target our persons living with homelessness and our migrant health with our substance abuse and behavioral health services. And our services are incorporated in our primary care. So you can't just call us and get behavioral health services. If you're in our medical care or dental care, our providers can make a referral to our therapists, and your services start from there. We also provide after hours and emergency coverage. So patients have access to us 24 hours. If you look at our network, we have mobile units. We have our fixed locations, and it's throughout the 4 counties, and the numbers represent the amount of sites that's throughout the counties. As you can see in Charleston County, we offer everything. We have our medical mobile units, our fixed locations in Johns Island, Hollywood, in North Charleston, and then downtown Charleston. We have our fixed dental unit in the Charleston area. We serve 7 Charleston County schools. And then we have 4 agriculture and migrant health camps in the area. And then we have a pharmacy that serves our patients that's on Meeting Street. And then you can just see it throughout the counties. We have a total of, I think I lost count, but it's like 27 service sites. Some are full-time and some are seasonal. Of course, our schools are seasonal, and our migrant camps and agricultural worker camps are seasonal. We're always looking for volunteers for our migrant and homeless camps activities. So if that's something you're interested in, or may have some students in need of internships, we actually take them out for that experience. In regards to our expansion, we're looking to renovate our Hollywood location. It actually is under renovation right now. We will expand from a 3,000 square foot facility to a 6,000 square foot facility, and it will include a drive-through, drive-up pharmacy, and that will actually be our first retail pharmacy. So we will serve the entire Hollywood community with our pharmacy, regardless to if you're a patient of FEDER or not. We're looking to open a women's and children's center in the West Ashley area. We have a retiring doctor that would like to work with FEDER as a part of his legacy, and so we're looking to open that facility. And then we're looking to open a men's health and wellness center in Charleston County. In Dorchester, we're in the process of actually opening a new dental site. And then in Berkeley, we're expanding on our pharmacies in Cross to become a retail pharmacy to serve that community. And in August, we will add 6 Colleton County schools. So this all is planned to happen in 2023. And I'll make sure that I keep you all posted. Very raw numbers, but as of last year, as of 2023, we served 23,000 unduplicated patients, and that was over 77,000 medical visits. And you can see that I used a chart to kind of outline where our services are provided. Of course, Charleston County has always been one of our largest counties, although It has been in Charleston for a long time. I would say where we struggle in Charleston County is with our pediatric population. And so we're excited to be in some of our school districts and some of our schools here in Charleston County, because we think that that would help with providing more services to our Charleston County residents. Our outreach activities, we are very intentional about being in our rural communities, and that's why you hear me talk about the Hollywoods and Johns Island, but we also go into our underserved communities. And then we have outreach teams that target very specific populations. So our healthcare for the homeless, we actually are at the Navigation Center. I know there's a new name now. And then we're also at the 180 Place. We serve our public housing communities. And then, of course, we go out to our agricultural migratory camps, and we just serve our communities wherever we are in very vulnerable populations throughout all the counties. When we talk about serving our population, especially with outreach, we have to make sure that we go in and our intent is to learn about the communities, make sure that we're genuinely interested. We try to use employees that are from those communities. So for example, our Johns Island nurse practitioner actually grew up in Johns Island and came back to practice there. Our Cross provider actually lives in Cross. Our pharmacist in Cross lives in Cross. So when we're doing outreach, we try to be very transparent about our process, but we also try to use individuals in that community because every community is very unique and their needs are very different. And we just try to be intentional about doing that outreach so that they feel like they're getting something out of it and it's not a waste of anyone's time. We were referenced about our COVID testing and vaccines. And when we started the process, our intent was just to go into the homeless shelters, maybe help DHEC with some of the nursing homes and things like that. We became very good friends with our DHEC offices, and they trusted us to help them with this initiative. And it definitely grew into something bigger than we could have ever imagined. I don't even think we thought that we could handle the volume we were able to handle, but we were very intentional about going into communities that were not able to get to big test sites where public transportation was not an option, or they were home with the children. We tested a lot of grandparents and their children. We used the Charleston County libraries as test sites. We used a lot of the churches. And so we actually were able to have memorandums of understanding with 92 organizations throughout the counties. And we provided testing in the actual community, at community centers, at football games, at soccer games, wherever people were that could not get to a location, we provided that testing, and we went back to those same locations to provide vaccines. We continue to test. We do have some of the rapid tests as well, and we continue to vaccinate. We also made the influenza vaccine a part of our initiative this year as well. So if individuals came in for COVID booster vaccines, we offered them the flu vaccines as well. We were able to make sure that we had individuals, again, that represent the community. Before we went into these communities, we went to community leaders and said, how could we reach individuals to come out to be vaccinated? And they were very articulate about what was important to their community. Some said, we don't want media. We only want people in our community to be tested. We don't want outsiders in our community. And we respected those requests. If it was raining, if it was really cold, because we knew people had difficulty with transportation or getting out of the house, we made it our business to show up regardless. We started to notice some social determinants of health. So we partnered with the food bank and we started to, you get a vaccine, we put a box of food in your trunk. We were able to partner with Direct Relief and get DoorDash gift cards so that we could give individuals access to food. We partnered with Low Country Street Groceries, and now we have a program where we were delivering fresh produce and fruit. And so while we were in the community doing COVID testing and vaccines, we identified other needs, and we tried to address those needs as well. We went on site to do that process, and we noticed a lot of literacy issues. So we took a lot of case managers out, and we actually were able to do the applications assisted individuals in doing their applications, because we realized a lot of people had that digital divide where they didn't have internet. Once we recognized that, we actually started to bring out our plum cases, our Wi-Fi plum cases, and we set up tables, and children would come to those tables and do their homework while we were doing 8 hours of vaccine clinics outside. Those were the things that for me were very humbling, because we would go into communities and they would wait on us that week, and their children would come out and sit the entire 8 hours to do their homeworks because they didn't have Wi-Fi for the rest of the week. And so we were just intentional. We went in those communities to serve and adapt what the community needed. In our COVID outreach, you know, if you did a lot of the drive-ups, there were a lot of stipulations. You couldn't come in this size truck. You couldn't bring your pets. You couldn't bring your children. We just accepted it all. We reached out to Charleston County and said, we need a walk-up booth, because when we go in some communities, 90% of the people walk up. That next week, they were able to deliver. We went to some locations, and the inside locations for vaccines were too small. So we popped up tents and did it in the field. We used our faith-based community to administer vaccine clinics, and we had people who would wait in line and run out of gas. So we started taking gas with us. We just try to do whatever we can do to serve those communities and to take away all the barriers to care. And that's all that I have. I try to be very quick. I know we're on a time limit, but if you have any questions, I'll take questions.
Thank you very much. Any questions? Well, thank you again. Appreciate all the great services and outreach that you and your organization do. It's extremely important, and congratulations, well deserved on the award from DHEC, and just thank you so much for all that you do.
Thank you.
All right, thank you.
Kevin.
Yes, sir. Paul.
Hey, Aretha, I know y'all in your 47th year of serving our community, and it's quite amazing. Are there any specific asks for the city or for our group here that we can help with your group, with what FEDER is doing?
Well, yeah. Well, there are communities that you feel like we're not reaching. Please send that information to me. Try to make that connection with someone so that they're comfortable with us coming in. And if you have community events or activities that you feel like the community will benefit if FEDER is there, we'll come out with our medical mobile units or dental units and try to serve those communities. And then share the word that regardless of their ability to pay, we want them to come in for healthcare, because that positively impacts all of us.
Thank you.
Oops, sorry, I didn't realize I was on mute. Well, thank you again. Thank you very much for all that you do, and thank you for that great presentation. I'm going to call on Dr. Katie Richardson to give us our community health update, if you would, please.
Of course. Thanks again. I thought I'd start with COVID. I agree with Aretha saying that they did and continue to do so much good work in the community around COVID testing and COVID vaccinations and education. And we still have work to do. The pandemic is not over. Yes, we did hear yesterday, I think, President Biden did say that the emergency, see if I can find the exact words, the COVID emergency declaration would end in the US on May the 11th. We don't know exactly what that's going to mean, and there has been discussion about, that day is not a day that necessarily vaccines are no longer going to be free of charge, or Paxlovid's no longer going to be free of charge, or rapid test, but it will begin the transition to vaccines being covered in the regular healthcare market. as well as the rapid antigen test, and likely Paxlovid. So I do want to give yet another shout out that the bivalent vaccine is available. It's been available since the beginning of September. It is now recommended for everyone 6 months and older who has had their primary vaccine 3 or more months in the past. And so the thought is that will likely become a yearly booster. And that is still available and recommended now for anyone who has not received it yet. It's available through FEDER, it's available through DHEC, it's available through many primary care practices and pharmacies. DHEC still has the web page that does discuss where vaccines are available in your area. So please take advantage of that bivalent vaccine. Everyone in my family has received that booster, including my kids, and we definitely recommend that. Thankfully, cases as well as hospitalizations have begun to decrease here in the state and the Low Country after the holidays, where we did see some increases. We still had 48 new deaths reported in the past week, over 500 deaths per day nationwide. So again, COVID is not behind us, and there's still things that we can do, like the vaccinations, that can make a big difference. There was a recent study that looked at why people have not gotten the bivalent booster, and really the two reasons that rose to the top were a lack of awareness about eligibility, that everyone 6 months and over is eligible and is recommended to receive that booster, and then overestimations in their own existing immunity from the vaccine or from an infection in the past. So there is, I think, good data to say that there's increased protection against both infection and severe disease with getting the bivalent booster over and above a prior infection and receiving previous COVID vaccines. So I think I'll stop there with the vaccine, only saying that, you know, as of today, only 15.5% of Americans have received the bivalent booster. So we definitely still have work to do. Am I sort of breaking up or no? I can turn off. Okay.
Yeah, it's a little fuzzy, but we can hear you fine. Yeah.
Okay, great. Let me know if that's not the case. In South Carolina, 32.5% of those 65 and over have received their bivalent booster, but only 11.4% of those ages 5 and over. So still a ways to go. Paul asked me to mention the variants. You may have seen some news about the XBB 1.5 variant. That is increasingly becoming a dominant variant across the nation. But South Carolina puts out a weekly variant analysis, and we're still seeing mostly the BA5 variant. Both of those are Omicron sort of variants or outgrowths of the Omicron variant. So I don't think that should change, you know, what we're doing, but I think it continues to emphasize the need for us to keep COVID on our radar and take whatever preventive steps are needed. That may be masking if you yourself are high risk or you're around those that are high risk. It certainly involves receiving your bivalent booster if you've not already, and having a supply of rapid antigen test in case you have been notified that you were exposed or you become symptomatic. We already talked about the COVID test available at DHEC, as well as the free safety kits. I wanted to mention an article that was in the Post and Courier yesterday on the cannabis edibles and the increases in emergency department visits and in hospitalizations with children who get a hold of cannabis edibles that are often in the look like gummy bears or cookies or brownies. And this can be dangerous. Many of those kids do require hospitalization after presenting to the emergency department for supportive care. And so this is something I just want the public and all of you to help to educate the public about these dangers in the community. I think this increase is coming because there's more legalization in many states, even though that's not the case yet here in South Carolina, as well as just the increasing variety of edibles that look like candy or sweets that children would be interested in. The Poison Control Center is available 24 hours a day, 7 days a week. That number is 1-800-222-1222. So if a child is looking unusually lethargic or maybe overly animated, maybe displaying dizziness, trouble walking, a rapid heart rate, all of those may be reasons, especially if the family knows that there are cannabis edibles in the home to seek care. We've already talked about American Heart Month. That is across February, and thank you, Paul, for wearing red. It's really a month to spotlight cardiovascular health. Just a little data, cardiovascular disease continues to be the #1 cause of death in the US as well as in South Carolina. And it, in addition, is the leading cause of early death and disability. So much of what we've talked about with healthy nutrition and active living are very important aspects, as well as quitting smoking, cutting down on alcohol use. And so we want to continue to talk about those things all month and all year. And lastly, I want to mention an event that Tri-County Shape sponsored last week on January the 26th. It was part of a year-long national dialogue on the intersection of racism and HIV as a public health crisis. And Charleston was featured for a 3-hour dialogue on the 26th. And we had a variety of Charleston participants that I really wanted to give a shout out to. This will be recorded. It was recorded, and it will be available for watching on the IAPAC website soon. I'll ask Paul to send that out when it is available. But we started with a webinar called Setting the Stage, Health Equity Challenges and Charleston's HIV Responses. We had Dr. Tawana Philpott Brown from the Ryan White Wellness Center at Roper, Michael Luciano from Palmetto Community Care, and Sakivia Lewis Kendrick from MUSC, highlighted on that panel. We then moved to Chucktown Intersectionality, Infrastructure, Segregation, and Food Access, really looking at social determinants of health. Giona Johnson, Director of the City of Charleston's Housing and Community Development, joined that panel, as well as Nakia Robinson, Tri-County Shape's Director. Laurie Tomlin with the Ryan White Wellness Center, and Renee Linyard-Gary, Director of Diversity, Inclusion, and Health Equity at Roper St. Francis. And we finished up with community action, organizing and campaigning for racial and health equity. And we're joined on that panel by Dr. Michael Moxley, who's Roper's Chief Diversity, Inclusion, and Health Equity Officer, as well as Richard Reams, who's the Director of Marketing and Development at Palmetto Community Care. So many thanks to Paul for helping to organize that half day of dialogue. And I really encourage those of you who are interested to watch part or all of that recording. And I think our next steps really, I think, are to to build on some of the themes that came out around access, around going to where those in the community need us, around many of the things that Aretha talked about that FEDER is already doing, but we need to sort of move away from silos, I think, and work collectively to make this happen in our communities. So that's what I've got, and I'm happy to take any questions. Thank you.
Thank you. Any questions? Paul? Paul, you're on mute.
Can I ask you, going back to the Narcan kit, when, you know, are there good signs that somebody is having a drug reaction or some, how would you know a Narcan versus a CPR, et cetera, in a situation like that?
That's a good question, and Jennifer may be able to jump in here as well. Narcan is not harmful to those who are not experiencing an opioid overdose. So it's never a bad thing to try it. It's usually not a sort of, I mean, I think for a heart attack or for an arrhythmia, you might see someone drop, you know, sort of be totally acting normally in front of you and then all of a sudden just drop. That's generally not the case for an opioid overdose. I think they're more gradually become somnolent. And so I think that is one way to know. I certainly think CPR is also, you know, called for if the ABCs of looking for airway, breathing, and pulse are done, and that's you know, an issue. So Narcan can always be used in concert with CPR, and obviously 911 needs to be called. But Narcan works quickly. It may need to be used again, and so there are 2 Narcans within the box, and the second one can be used several minutes later. Sometimes people recover very quickly, but then often or may need the second dose as the sort of opioid receptors again are what's the word? Basically, the opioids begin to show their effects again as the Narcan wears off. So, Jennifer, you have any other thoughts there, comments?
Yeah, my thought was to ask Aretha Powers what her thing is, but I mean, I would agree with that, but I'm not the expert on that either. I was just thinking that maybe we should even invite, you know, someone from Charleston Center to speak at one of our things. But I do think Aretha may have some more information. If you don't mind, my picking on you.
So I would agree with what Katie said. What we've seen is the one case I experienced in the lobby not so long ago was the person just kind of stopped talking and then had a reaction. And so the providers came out and administered an Narcan, but we actually had an in-service from Charleston Place for our providers as well, and even our front desk staff, because most of the time they don't make it to the medical providers. You have to be other community members that's aware of what's going on. So I would agree with you to invite someone from Charleston Center to talk with the group.
Thank you. And then Kevin, one more question for Katie, and that is remind us of all the services at the Health Services Center.
Yes. So I'll cover the other agencies first. There's DAODAS, which is Charleston Center. They provide both inpatient and outpatient treatment around drug and alcohol abuse. There's DSS, which I'm sure does more than I know, but they provide the Healthy Connections and work on helping people get Medicaid services if they are eligible. The Department of Mental Health will have their Crisis Stabilization Center there, as Jennifer was mentioning. And then within DHEC, we have vital records there. So it's the vital records hub for Charleston County, birth certificates, death certificates, and I think marriage certificates as well is available there. We have maternal child health. We have WIC. We have preventive health, which is sexually transmitted infections, diagnosis and treatment, and family planning services. There's immunizations. We're about to have immunizations at Charleston County Health Department. Right now, we have immunization certificates. So if someone needs a certificate of what vaccines they've received, they are able to get that now at Charleston County Health Department, and soon we'll be able to get immunizations there as well. We provide treatment and diagnosis for tuberculosis at that site, and many of our management offices are there as well. So lots of great services all under one roof. I do hope at some point, and we'll probably be talking to Jennifer about this, we hope to do some sort of community fair to let the public know that we are there and what services are offered. The library will be open soon. So it's going to be a great site. The transit hub is close by, and I think it will be a great benefit to the community. It's already a beautiful facility, and I think shows the respect, for those residents who need these services that they deserve.
Good. Any other questions for Dr. Katie Richardson? Well, thank you, Dr. Richardson. Another very thorough report as always, and thank you for all you do and for sharing all that great information. Again, want to thank Aretha Polite Powers for joining us and giving us some great information as well. And thank you to all of you who spend so much time to help the city of Charleston be a healthier and better run city. So our next meeting will be March 1st at 9 a.m. Wednesday, March 1st. And if we don't have anything else to come before this committee, we are adjourned. So thank you very much.
Thank you.
Thank you, everyone.
Bye.